Welcome to Neosho, Missouri, where its name means clear, cold water, where well-known vaudeville performer, actor, and social commentator Will Rogers went to school, and the place Mitchell's Drugstores calls home. Owner Tim Mitchell takes great pride in taking care of his community.
Well, I graduated pharmacy school at University of Missouri, Kansas City School of Pharmacy back in 1996. Worked for a big chain for about a year. Decided that I wanted to work in an independent setting. I've been able to take care of people that I've gone to school with. I've been able to take care of my school teachers. I've been able to take care of my family members when they come in here, have a need, or whatever the case may be.
Not only does Tim enjoy taking great care of his patients, but he is also able to share his passion with his children.
Working with our dad every day is definitely a special treat that I think we both really do cherish. We look up to his entrepreneurship, and I think at all aspects of our life we try to do it to the best of our ability, but whenever you're in a business with your name on the outside of the door, it really just makes you care about it a little bit differently.
Mitchell's Drugstores has made helping their community their top priority and wants to learn new ways to market its services.
Some of the things that I'd like to see is the opportunity for us to figure out some creative ways to do some marketing. Some ways that we can, and we already do some marketing, but maybe we're not doing it the best way we can be doing it.
Open to improving their marketing strategies, Tim called us and said, "Show me how to market my vaccine program." NCPA's Hannah Fish is on the ground to assist.
We are here in Neosho, Missouri at Mitchell's Drugstore to help Tim Mitchell and his staff improve his vaccination program through better marketing. So we're excited to bring our expert in, Nicolette Mathey, to help him and provide him some tips on how he can do better.
Joining Hannah is peer expert Nicolette Mathey from Palm Beach Harbor, Florida, to see how she can help Tim and his team.
So today, I'm excited to talk with them about just the structure of their appointment-based model. They're doing a really good job, and I think it'll help them go to the next level if they start to also push a follow-up and really tap into that. That'll lead to more online reviews, which will lead to a better presence on Google My Business, which is huge for community pharmacies like ours. And then with that, getting that increased exposure and digging deeper into expanding their vaccine program, they're going to want to actually assign projects and team training and kind of like everybody rowing in the same direction. So assigning some KPIs and really making actionable progress that they can monitor in their data, and also making sure their team feels comfortable with it.
Hi guys.
Hey Tim.
Welcome.
Thank you.
Nice to meet you.
Hey Tim, great
Nice
to see
to
you again.
see you again. Yeah. Let's come on inside and check things out.
Great.
I'll show you around the store.
Tim gives Nicolette and Hannah a brief tour of his pharmacy and shares his excitement about learning new ways on how to improve his marketing strategies.
That's why you're here. I mean, I want to hear what you guys have to say. You're not from this community, but you guys are leaders in the profession, and I appreciate anything that I can get from peers to be able to bring it to the next level. So I'm excited about it.
I'm excited to kind of dig into the specifics of what's going on, and maybe just a little tweak here or there, or even if somebody watching at their store, that's the beauty of it, is the networking.
After the tour, Tim invites Nicolette and Hannah to observe his vaccine process and how he engages with patients about upcoming vaccines. Nicolette then sits down with Tim and his clinical director, Lacey Epperson, to share her thoughts.
So that was great. Thank you for letting me be a part of that. I wanted to put the gloves on and give the shot myself because we're all so used to it by now, right? But walk me through, like this patient, for example. Was he a walk-in or was his shot already scheduled?
So Gary was here to get a prescription, and Lacey was reviewing his profile, noticed that he hadn't had a Tdap shot in a while, and so she approached him, talked to him about it, looked at the registry that it's called Show Me Vax. We were able to notice that he hasn't had a Tdap shot in the last 10 years. I verified that with him. He did not remember the last time he had it. And so from there, she alerted me and said, this is what we can do. Of course, Lacey gives vaccines as well. But the whole point is the team effort. Noticed that we were able to identify the possibility of being able to do a vaccine. Offered that to him, and then we went from there. So
that brings up an important point too, in that there's a lot of different ways to determine if a patient is eligible for a vaccine, and you brought up a good point of checking your registry, but then also asking the patient.
One of the reasons why we really wanted to do this and have you here is to help us understand better ways that we might be able to market or get out there into our community or into front of physicians or wherever we need to be. And I know Lacey and I have talked about trying to expand other clinical services, and she's really focused on doing that. What are your thoughts on how we need to make, or what kind of opportunities we might be able to have moving forward?
Absolutely, and that's a great point. I mean, we all have, our patients who walk in, but that's only a fraction of the people who we can reach and serve with our different offerings that we have. So definitely online and marketing, physical marketing, doctor detailing, all those things are important, not only with the vaccines, but every service that you provide. So I did notice that you guys currently on your website, you have it really nicely outlined, your different immunizations, and you even have the CDC patient scheduled chart on your website. And I thought that was really interesting. I liked it. It can be overwhelming, and that's fine, but I think that I use that as a piece sometimes just to talk patients through, and especially, as this gentleman was due for a tetanus shot, you wanted to start to have that conversation with him about maybe other shots he might be due for, or,
At this point in the conversation, it's clear Tim and Lacey have a pretty good handle on reaching their patients. Nicolette gives them a few tips on how to better market their services to the community. They can use online and physical marketing to reach their patients and schedule appointments, have discussions with patients, and talk about upcoming vaccines they will need.
So I think one thing where we're at is we're utilizing the appointment-based model, but I think we're trying to have awareness of when to capture certain individuals. So if it's someone we know that we'll repeatedly see and they're a repeat customer, we're maybe don't want to overwhelm them in certain visits. But it's also that, post-COVID, there's also so many other chronic disease states that we need to be thinking about and be protecting some of these high-risk individuals. And so we're trying to, I think we're trying to do a really good job about utilizing our other services that we have in place to, for lack of a better term, double up and see how else we can serve the patient and be efficient in these processes. So if you have any feedback on that or any suggestions for us, that's kind of where we're at. We're trying to do some of these things, but we're just trying to capture a larger audience in our community.
Yeah, I think that's great. And I overheard you mentioning that you were thinking of focusing on a certain vaccine, maybe for a certain period of time, because it can be overwhelming. You said there's so many vaccines and you have your current workflow all going on, and then you want to go market to the exterior community, and it's like, wow, how do I market all these things at one time? Sometimes an easier bite-sized piece is telling the team, hey, for this quarter, we're going to focus on the new pneumonia vaccines. We're all going to learn what the new guidelines mean.
Oh, great idea.
And then we're going to put together some goals, currently, where are we at? And then you could even, maybe you could spend a week or so to research or assign someone on your team. Do some research. See how many of our active patients, look in the registry. If you have that automation, find out. But you could even manually log in and look and just see who's due, how many patients are due. And then you can start to brainstorm, how do we reach them? Are we going to get them when they're coming in? And then kind of snowballing on that. It's one thing to educate the team so they feel comfortable, because that's going to be important, because patients are going to have questions. Hey, you're due for this.
They've got buy-in.
Yeah. Right. So even, of course, the technicians aren't going to do a whole consultation, but we do want them to feel comfortable enough to offer that to the patient and then go grab the pharmacist when they have more specific questions.
More great tips for Tim and Lacey. They can set quarterly marketing goals, assign a technician to check the registry to see which patients are due for a vaccine, and educate the technicians about the vaccine so they'll be comfortable speaking with patients. Listening in on the conversation, Hannah has one concern.
Yeah, it sounds like they've got an awesome team, and the only thing I'd be concerned about is them trying to do too much at once. They've got lots of great services, and I think with Nicolette, just helping them hone in on some of those goals and objectives of how to actually target, taking those quarterly goals that she's mentioning. I think that's going to be really great for them.
After the roundtable, Lacey had a few more questions to ask Nicolette before she got back to work.
One of my big focuses that I would like to expand as well. So we have, I believe, I could be wrong, I think we have 6 community health workers on staff. And so we're really trying to focus on utilizing some different templates to evaluate social determinants of health. And I really want to increase, of course, these people flex as our MedSync technicians, and they work throughout our workflow.
Yeah.
But I really want to increase how they can help identify patients that may be receiving limited access to vaccinations or limited access to different healthcare services. And so I guess kind of from a community engagement and marketing perspective, and even our technology, do you have any kind of recommendation or thoughts on how we can utilize something from our system to give them something tangible to get out into the community?
Definitely like what you were saying about kind of on the technology side, e-care plans. And, if you do have someone looking in the database and looking in the profiles and determining that a patient is potentially due for a vaccine, putting it in the e-care plan and having it show up as a task or a priority or something like that. But then it would come down to, assigning an actual person on the team to go through it. And then you'd have to determine, are we going to call these patients? Are we going to just have like an outreach where we call these patients not about their prescriptions or just to talk to them about that vaccine? Or are we going to piggyback it onto their sync calls? And or are we going to, maybe put a note, or a lot of pharmacies will put like a card in the bag or the basket, so when the patient comes in, it says, oh, hey, you have to talk to the pharmacist about a vaccine or something. So there's a lot of different things you can do, and it depends on where you're currently at, which you guys are kind of in the middle of it, which is good. You're not just starting, and you have a lot that you've already done. And then it kind of depends on how does your team currently work, and what's their capacity, and maybe like willingness to use certain new technology.
At this point in the conversation, Nicolette shared some helpful tips to help get the staff involved. Lacey can train team members to use their technology to flag patients due for vaccines and determine how to reach the patients.
Yeah, I think this is great. You guys definitely have a really good start. Let's have you work through the process and create that kind of templated, this is how we want to determine if any of our current patients are due for vaccines, and this is how we're going to communicate that to them. What do you think about kind of setting a goal to having that done in the next 3 weeks, having that process, working with Tanner, and being ready to train your team on that?
Yeah, I think that would be great, because we're trying to hit the ground running with this anyways, and so I think that would be a good timeline for follow-up, so that for our own sake too, internally, we can make sure that we're achieving the goals that we've set for ourselves. So
I think their current workflow is great. It's wonderful that Tim has made the investments into a clinical director such as Lacey, and really given her the autonomy and the ability to put these systems into place and really follow them, because you do need someone who's going to be focused on that clinical program and services, both from a regulatory perspective, working with the team, and then working with the marketing team. So it's really great that they've made that investment.
But Tim and Lacey are not the only ones who are ready to make some improvements.
I think one of our main goals is just to find what she's doing and what's working for her and her pharmacy, and be able to kind of apply that for ourselves. We know that the standard way of marketing, of just hanging up a poster in your store, isn't always going to do the trick. So finding the unique ways to be able to market to our set of patients that we're looking for is what I'm really looking forward to.
Tanner, Taylor, it's really nice to meet you. I've heard so much about you, and I think that's awesome that you work in the store with your dad. That's really cool.
Yeah, thanks for coming. We're excited to have you.
We are. Nice to meet you.
Good. I've been really looking forward to talking with you guys and kind of getting into the nitty-gritty of maybe the marketing and the social media and website kind of side, so this will be fun.
First of all, I had a question for you.
Sure.
So in pharmacy, we have a lot of these really cool ideas that we can think of. We have so many beneficial things that we think our patients need to know, but not everything that we need to let them know is for the general public. So we're trying to find the best way to identify these sets of patients that these can apply to and kind of market to that set amount of, or section of patients.
Yeah.
So I was going to see if you had any tips on how to best identify these patients or what data we should pull to be able to identify these patients.
Have you run ads on Facebook where you can identify your audience?
Just very briefly.
It gets
But
kind of
not too
tricky because, of course, we can't segment down to exactly what we want.
Sure.
But you can sometimes run ads and run them on only certain age groups or only certain genders or only certain zip codes and things like that.
Yeah.
Pharmacy's tough, too, because we can't advertise or promote or boost or pay for if we're putting a drug name in the text or if we're putting, a lot of times even if you put the word COVID, you'll get flagged.
Yeah.
So we have to kind of dance around that a little bit. I know we went and got some additional certification, but it's still not kind of made in the shade. We still have to jump through a lot of hoops.
Sure.
But there are ways, like you can put the picture of the vaccine and then in the text just don't say the actual word Pfizer or COVID or amoxicillin or whatever it is, which other professions probably don't have to worry about that, but we do.
Yeah, no, that's a great idea. I think that would help us kind of narrow our target audience. And like you said, I think we could probably just do that locally and be able to get people, because we don't want people far away. I mean, it's good for them to know, but that's not really who we're trying to get in our stores. So that's a good idea, trying to find those people who are local to us.
It's just a different generation that we're marketing to.
Yeah, it's true.
And so that's, one of the challenges that we're trying to figure out how to navigate. So my next question for you is, we use Instagram, we use Facebook, we're, using TikTok a little bit, really just to educate. But what other, depending on the demographics of our clientele or our patients, what else do you suggest we do? Like, have you tried the mail flyers, or how have you gotten really engaged with the community in marketing?
We primarily focus in my store on digital marketing, but I like organic digital marketing, maybe because I'm cheap, I don't like to pay. And pharmacy, just reimbursements are tough as is, so it's hard to swallow a $1,000 a month ad budget or something, unless you know
it's going to work.
What you're doing and you're kind of not throwing money at the wall and seeing what sticks. But organic digital marketing, and then we do a lot of physical marketing too. And it's the same message, but the physical marketing is usually like a B2B, business to business, rather than a B2C, business to customer. So we do our physical marketing to prescribers and travel clinics and other small businesses, and we create a lot of print material and custom folders and stuff for those specialties. But we'll use a lot of those graphics in our social posts too.
At this point in the conversation, Tanner and Taylor have been given some helpful tips. They'll want to use different marketing methods to target various groups in their community, leveraging social media to reach patients, and print materials for small businesses.
So, for an example, where we post online, we use a scheduler. So there's a lot of them out there. But we use a specific one that when we build a post in Canva, and one of my technicians is really good at just creating Canva posts, and I give him time on the clock to work on that. We know we want to post out at least 3 of them a week, and it's just part of the job that we do to let people know all the services that we have. So with that, he can create a Canva post and he can put it in this online scheduler, and we can schedule that post. And so we try to be a month out, but that doesn't always happen. But when it posts, it'll post to Facebook, LinkedIn, Instagram, and Google My Business. And interestingly, the Google My Business has been huge because we have that set up along with Pointy for our over-the-counter items. And that way when people, it's all about in technology meeting people where they are. So if they're on their phone and they're looking for raised toilet seats, we just posted about that. Raised toilet seats near me, or wheelchair near me, or compression socks, or whatever it is.
Tanner and Taylor are ready to get started. They'll just need to develop a content calendar to stay organized and work on a plan to increase the number of 5-star reviews.
If you don't have a solid online presence, you might not seem trustworthy, or, because we all love to read reviews. Typically what we see is you need to have at least 40 4-star or higher reviews in pharmacy to kind of stand out as a reputable, relevant place. I noticed on your Facebook, you guys have more than that, which is good. Do you know, there's 4 main kind kind of review places where patients can leave reviews for pharmacies. Google My Business, and Google is the biggest.
Okay.
They make up probably about 75% of all online reviews for pharmacies. Second would be Facebook. And then really small, maybe 3-4%, is TripAdvisor and Yelp.
Oh, gotcha. Yeah,
Interesting.
things that you don't think about.
You know how the patient can book an appointment online and it'll send them a text and an email when they book. Maybe an hour before, it'll send them a reminder email text. Our software has a feature where you can send the patient a follow-up text and email, and we chose 1 hour after their appointment ends. For whatever reason, and we tinkered a lot,
Yeah,
but
that's a
for
great
whatever
idea.
reason, that seems to be when patients are still feeling good about their vaccine. They're not having side effects yet. They still feel good about their test because they got a yes or no, and we help them through what to do next.
Yeah.
So an hour after their appointment ends, for whatever reasons, is a good time to reach them. And then we kind of perfected our script and tweaked it so that we ask them for a review. But we do so in a very humble way.
Sure, yeah.
Where we thank them for trusting us with their care. We're a local, independently owned community pharmacy. We appreciate them placing their trust in us, things like that. With that being said, I'd like to kind of set a goal of something that you can do and work on, and then maybe we'll follow up in 3 weeks and
Yeah,
just
that'd be
see what
awesome.
progress you've made. So I would turn on with your appointments a follow-up,
Yeah.
and then we can work to explore too a scheduling, social media posting scheduler.
Yep.
If you want to look at reviews software.
Tanner and Taylor got some great pointers from Nicolette and have a few goals to tackle.
Conversation with them went really great. They're doing a lot of these things, but I think there are just little efficiency tweaks that can save a lot of their time. So their project is going to be integrating a scheduler, integrating a social media scheduler. And the schedules should all make sense and fall in line. For example, if they're going to focus a quarter, so 3 months, on boosting awareness and vaccines on shingles, the team would be trained on shingles throughout that time. All the policies and procedures would be put in place to identify patients, to market to the local community, and also to do all the social media marketing and education about the shingles vaccine.
With marketing skills already in place, by adding a few of Nicolette's tips, Mitchell's drugstores will be able to reach more of their community. A few weeks later, NCPA checked in with Tim and his team to see how they were doing.
Lacey, I wanted to check in and see how things were going and what progress you've made with your team on setting up your care plans and kind of getting that whole vaccination process into the workflow.
Yeah, so we do have that in place now. The main thing that I wasn't necessarily planning for was we actually had a lot of cleanup as far as our system goes to make sure that we had everything set up correctly. So I had quite a few steps beforehand that I had to work through before actually setting up the care plans. So, but I got all that done, and I did set up the care plans. We also, I made sure to train the appropriate head clinical people that I train, and then they're working on disseminating that information to the rest of our team. So we do have everything set up appropriately so that we're ready to roll with actually utilizing what we've put in place.
That's great. And then I know when we were there on site, we talked about maybe even focusing on one vaccine at a time so that you could talk with your team about it, review the CDC guidelines and recommendations, make sure everybody feels comfortable initiating those conversations with patients. Have you kind of gone any further down that road with like focusing on a specific vaccine or making sure the team is comfortable enough to start that question with the patient?
Yeah, so that was actually the first piece of advice that I took from you was, you're right, 1 month goes by faster than what you think, especially when you have your hands in quite a few different things. So yes, I'm starting with one vaccine, and instead of my initial plan of one vaccine a month, I'm going to try a quarter and try to surround other clinical services around that theme as well, based on the vaccine that we're wanting to promote and recommend and teach our technicians about. But yes, I think that's a highlight of what we're really trying to focus on is from start to finish, from every patient touch point, just making sure that each technician knows what their role is and being able to identify a candidate for a vaccination.
With a few tweaks of her own, Lacey has made great strides with the staff. Let's see how Tanner and Taylor are doing.
Based on the goals that we set, we've been really focusing on what we talked about trying to be proactive with our marketing and trying to decide, make sure that what we are marketing kind of coincides with what you talked about with Lacey about focusing on a specific, whether it be a vaccine or a specific thing that we want to focus on each quarter, and trying to find the best way to prepare for that. But we've been working on making a little calendar like we talked about. We've been brainstorming together of the best ways that patients can get interested in these services that we offer, or the best way to educate them on the things that we want to educate them on. So we've been making little game plans together, lining up our week and our month, trying to figure out the best way to do it. And it's really been helping us so far. We're not scrambling, trying to figure out what to post. And we feel like it's a lot more comfortable for us to be able to do so.
That's great. So with the posting, have you had success like kind of finding and claiming your Google My Business, and you may already have, but just making sure that that's all set up and that you're able to post to Google as well?
Yeah, so we kind of just went and cleaned our Google up. We had a lot of old photos and things like that. So we went in and just cleaned those up to our new, more streamlined, clean pictures. And we're going to continue to keep working on that and really just making that a source of not only information for the patients, but also marketing. So trying to be smart and not double our work there. But like he said, I think one of the main things is just making sure that we're all on the same page. So your goal of, focusing on one thing per quarter, we're just figuring out how we can tie all of that in completely together in the aspect of not only education and performance in the pharmacy, but also marketing in and outside of the store as well.
What about the online reviews? Have you been able to make any progress? I know you were checking on your scheduling system and your website to see if there is a way to automate asking the patient to leave a review after their scheduled clinical service.
Right now, we're utilizing the QR codes, and we're giving patients these QR codes after we feel like we've had a successful encounter. So whenever they feel like, maybe we gave them an immunization and they seemed really pleased with our services and things like that, we're just letting them know. And we've made a few social media posts as well. But we're trying to tell them, kind of prefacing and saying that, these reviews are really important to helping us support our community and keep our, business where it needs to be and be able to continue to take care of the community. And they're all like, oh, and I think sometimes when you kind of explain it rather than saying, can we get a review, just letting them know how important it means to us, how important it is to us. I think that's been helping the patients, and we've been getting. Hey,
we're happy to report. You can check it. You can fact check us, but we got another 5-star review today, just this morning.
That's awesome.
Nicolette also had a chance to catch up with Tim to see how he was adjusting to the changes.
So Tim, you kind of initiated this process with reaching out to NCPA and having them come in, and you're a very well-established store. Has this been beneficial for you or exciting for you to see me and NCPA and just the whole teams working together? It wasn't all kind of on you to disseminate to the rest of the team. How did that feel for you?
When I look at this whole idea of the Show Me series and what's going on in our stores, I can tell you I get excited when I start seeing the younger generation get involved, start understanding kind of what's going on. And, when I first started in pharmacy, I really didn't know everything I needed to do. And I was working at an independent store by myself, had one store and trying to figure things out on my own. I think this is amazing that we have access to someone that has nationwide reach, such as yourself, to be able to help people do marketing, NCPA to be able to help me understand where I need to be focusing on and being able to do those things. So when I reached out to NCPA about, hey, I'd be interested in being involved, they did say, well, you have a pretty good program now, why do you want us? And I can always tell you that I feel like there's always a chance for things to get better.
The Mitchell's Drugstores team is well on their way. They have set up their system for care plans and trained the clinical staff. They've created their content calendar and even received a few more 5-star reviews. Another great example of what happens when community pharmacists call us and say, "Show me."
Thanks to Tim Mitchell for letting us come to his store, Mitchell's Drugstore, and educating his staff, Lacey Epperson, his son and daughter, Taylor and Tanner. They really took in everything that we gave to them. And thanks to Nicolette Mathey for being our expert in this area to help them with their social media, online marketing, and general efficiencies. And thank you, viewers, for watching Show Me from the Show Me State. And we hope you enjoyed watching all of the Show Me vaccine episodes.